everybody. Ow. It's Danielle. I hope you're doing well. I'm coming to you from my bed after my spinal cord stimulator trial. And I just wanted to give you an update and let those of you out there who are considering the spinal cord stimulator some info on it. I'm hurting pretty good right now, but I'm on a lot of painkillers, which is making me feel a little bit better. Pardon the fact that I look like I got hit by a train, because I kind of feel like that, but okay, so I wanted to let you know exactly what they did when they went in and did the stimulator. This is for the trial. So again, the first part is you discuss with your doctor whether or not the stimulator is an option for you. From there, you have to go to a psychological evaluation, which I described to you on the blog, which is a bit of a nightmare. If you pass that, then your doctors contact your insurance and try and get the approval. And from there, you do the trial stimulator for about a week, roughly, and that's just to find out whether or not the stimulator is going to work for you. And then if it is, they schedule the actual stimulator implantation. So the trial stimulator, what they do, I'm going to try and turn around and show you this. They take two needles. Well, they're sort of needles. They're hollow tubes. And they stick one up inside of you. And so they basically stick the tube up inside of you. And in the tube, they feed the lead, which has the electrical, which sends out the electrical impulses. They stick the lead up, they feed it through there, and then they pull the tube out. And then they do the other one. So they put the lead up there, they put get the lead up there, and then they pull the tube out. So basically, all it is two pretty fat needles going up inside of you and placing the leads. And then they kind of maneuver the leads around in your spinal cord area. It's in your epidural area, so it's in the hole. This is just in an open space. And they try and get them to a point where they will stimulate the exact area that you're having pain. So the area that I have pain, which I've shown you on the blog, is a really strange area for pain. It's not something that they normally will typically treat with a spinal cord stimulator, but because we were at the last option, or so we perceived as the last option, that's what we went for. My area of pain wraps around from about here all the way around to here and up. Normally when they use a spinal cord stimulator, they will tend to treat a specific pain, like arm pain or leg pain, or a pain that's in your lower back region. But to get a stimulation that will treat a pain in your flank area that wraps around is really difficult. So what they did is they stuck the leads up there, and they kept pushing them in and pulling them out and stimulating them, turning them on and off to try and get them in an area that would wrap around in the location that it should. So it took a lot longer than a normal spinal cord stimulator trial procedure would take. When all was said and done, they were able to get the stim to kind of go in this area. And so we patched me all up. The idea is to keep the patch completely sealed up so that you don't get an infection, because obviously if you're sticking something into your body, especially with something large, you have, room for infection. So they're trying to keep everything out of there. The problem with EDSers, as you know, is tape rips off our skin, and we can get rashes and have allergies to the adhesives, which I am completely allergic to these adhesives, and all I want to do is scratch them off of my back. So I've been taking Benadryl to try and calm that down so that I'm not raking these off of my back. So from there, what you can see is the cords that go, the leads that go up into my back are taped, they're taped down. And then the leads are hooked to these, little transmitter things, which then come down and they hook to the generator, which is a big battery pack that I don't have attached to right now. On the generator, which I'll have pictures on the blog, basically it has different settings, and the rep from the company will help, work with the settings. So try and find something that is calm enough for you, but is strong enough to stimulate that area. So we worked with it for a few days. The first few hours that I had it in, we definitely were able to get it to wrap around that area. And then after I went home, I started experiencing excruciating pain, and it has not let up at all. The first couple of days, actually, it was pretty bad. I was literally in tears the entire time. Since then, in addition to all the painkillers they had me on, they stuck me on Valium to try and calm it down. They also said that the Valium can sometimes help the spinal cord nerves calm down a bit. So I'm barely managing to get through, but I think it's important that all of you see what exactly is going on when you're going to get something like this done. So basically the trial, again, is just to see how your body responds. By day 3 or so, the area that they stuck the needles in should be calmed down quite a bit, and you could differentiate between the area of your pain and the area where you have just the uncomfortable, sensation from where they stuck the needles in. Unfortunately with me, it's one big mass of horrendous pain. If they turn the stimulator on whatsoever, I get muscle spasms, and now I just have this chronic pain around here that is far worse than what I was dealing with before, which I thought the pain I was dealing with before was pretty much at the top of the top. I would rate it at, in the morning at about a 6 out of 10, at night at about a 9 out of 10. I always gave a little leeway because I assumed that even though I was crying my eyes out at night, that there could be worse. Few nights of this, I was at a 10 out of 10. I literally thought I was dying in pain. It was that bad. So what we've decided to do is disconnect the cables from the device, and it's a no-go. We have tried to let everything calm down a bit, see if the inflammation would go down, and then try it again. I tried it for the last time this morning. Instantly, the moment I turned it on, the pain was back and it was ferocious. So I turned it off quickly, unplugged them. That's the end of it. It comes out on Monday afternoon, and my trial is over. It was unsuccessful, and that's about it. As we know, with being EDS patients, we tend to be the weird ones of the bunch. I definitely was with this. Only 10% of the people that my clinic deals with don't pass the trial round. So, that means 90% of the people this works for, and they go on and they get this stimulator implanted. Unfortunately, I'm that 10% that it's not going to work for. Out of all of those, The rep, the doctors, and the rep's mentor have only dealt with one other patient that not only has the pain not subsided with the stimulator, but the pain actually became worse with the stimulator. So, of course, as usual, I'm the freak of all of the freaks that deal with all of this, which I'm used to being, that we have something that's rare and nobody knows how to treat it. So I'm really hoping that there is some other treatment out there that I'm able to find something to alleviate the pain a bit. I'm trying to stay in good spirits, and the drugs at the moment are helping. I will admit that. But pretty much I'm living on a heating pad as usual. And as soon as I get off of this video, I'm going right back to the heating pad. Anyway, I hope you guys are having a good day, and I hope this has been informative in the very least. If you have specific pain in certain areas of your body and you don't have Ehlers-Danlos syndrome, maybe it'll work for you. It seems to work for a lot of people. Those of you who have EDS, I've been told by several doctors that specialize in EDS that it does work. Obviously, it's just very limited to the one area of your body that they're trying to treat. It's not going to help your entire body and all of the pain in it. But if you can treat that one area that's your worst area, then that's a good thing. And then, unfortunately, in my case, it's not going to work with anything. So, alright, that wraps up today's segment. I will talk with you guys soon. Bye.